You know, Chattanooga is a runner's town. We're a very active, athletic town. So if you are in that category and you're finding yourself facing the possibility of having to have knee replacement surgery, no doubt you're asking lots of questions and getting advice from friends on what you ought to do. Well, you are very much in luck this morning because we've got one more arsenal in the wheelhouse. Dr. Timothy Ballard joins us. He is with the Center for Sports Medicine and specializes in total joint replacements there at their practice. This morning, his focus, though, is on that ever so worrisome knee replacement surgery. Good to see you this morning, Dr. Ballard.
Hey, good morning, Julie. Thank you for letting me be here.
I think I used a word purposely. You might have winced a little bit, but I said the word worrisome because I'm sure a lot of patients come into your practice, they hear that knee replacement is in their future, and they do worry. You have the great benefit, though, of putting those fears to ease.
Sure, and I think it's perfectly normal to have some anxiety when you're coming into a situation that you don't understand, and particularly when it involves surgery. But one of the most exciting things that we have in medicine now is the ability to help people return to function through joint replacement surgery. You know, I've actually been in town since 1996, been doing this for 26 years. This is the part where you tell me I don't look old enough to have been doing this for 26 years. And during that time, I've done about 30,000 joint replacements, and I've seen a lot of things, a lot of different innovations come and go. You know, when I started in practice, patients typically stayed in the hospital for about 7 or 8 days, and now we've got that down to where that most of my folks go home within 24 hours. In fact, I have an awful lot of people that we do in an outpatient setting and go home the same day. I don't let them go home until they're able to get in and out of the bed and on and off the toilet and up and down a few stairs. So you're getting around well before we let you go home.
You're throwing a lot of, can I ask you something real
Sure.
quickly? I don't mean to interrupt you, but you are throwing a lot of impressive numbers at us as if it was no big deal. But can I go back and just focus on these a little bit?
Sure.
I think you said 30,000 of these surgeries performed.
I know. When I got here 26 years ago, I prayed that I would have a busy practice, and that's what's happened. So I don't know, just the time goes by and all of a sudden you look up and the numbers are huge, but I'm still humbly grateful every day.
Well, okay, then the other number that was very impressive to me was 24 hours on average as a hospital stay. That's nothing, Dr. Ballard.
Yeah, it's changed so much. It's really been exciting to see. And as I said, a lot of my folks actually go home the same day. Our practice has the benefit of having a comprehensive ability to take care of the patient from imaging, MRI, outpatient services, durable medical equipment, physical therapy, and we have all the orthopedic specialties covered. And one of the things we're going to touch on today too is that our surgery center, I believe, is the only one in this area of the country that has its own robot. And so before I can talk to you really about what robotics means in total joint surgery, I first need to talk to you a little bit about the basics. So we're talking about knees in particular. Your knee, of course, is made up at the end of your thigh bone or femur and the top of your tibia or your shin bone. And where those bones come together, there's cartilage like the gristle on the end of a chicken bone. Then, of course, your kneecap sits out front. It's kind of like the pulley in the middle of your quadriceps. Well, that cartilage gives it a smooth, glistening surface, and it doesn't show up on x-ray. So when I take a plain x-ray, I can see a dark space between the bones. When that dark space is gone, that's bone-on-bone arthritis, which is the same as osteoarthritis or degenerative joint disease. Early on, with the inflammation that's associated, some anti-inflammatory medications, a cortisone injection, in certain circumstances, physical therapy or bracing may help. But when you get to the point that you've got bone-on-bone arthritis, you're not feeling better from other things, and it's affecting your life, it may be time to consider joint replacement surgery. In a nutshell, with a total knee replacement, what we're doing is putting a new surface on the end of the thigh bone or femur, on top of your tibia or your shin bone, and on the back of your kneecap. There are several different ways to do that. The conventional way used what we call conventional measuring and targeting devices. There are little guides that help me to make the cuts so that I can put those new surfaces. What robotics does is actually helps you to make those alignments, and so the robot makes the alignment for you. What I want to make sure that people understand is that the surgeon is still doing the surgery. We still have to make the incision, do all the surgical diagnosis, expose the bone. However, from there, the robot can help with some of the alignment. The robot actually doesn't do any of the cutting, though. The surgeon uses the saw. And that's the big thing about robotics in orthopedics. Robotics has been exciting in other areas of medicine, which I'm not going to go into at length, but in our world, that's what robotics does. There are some things that robotics doesn't do. So you may have heard that robots reduce surgical time, reduce incision time, reduce recovery time. That unfortunately is not true. But what robotics do in our world is they give you another option for how to make the alignment. And I'll be transparent with you also in telling you that the research shows that what robotics do at this stage is that they can help someone that doesn't do as many joint replacements to get that alignment just right, but they're not critical for people that have a busy practice. That being said, I think that every patient should have that discussion with their surgeon of whether or not it's appropriate for them.
Okay, so wait, let me pause you there too, because if I heard you correctly, you're saying that in your case, where you've done 30,000 of these surgeries, you might not need the pinpointed nature of that robotic as much as somebody else might, but you still find the benefit for your patients in having the option?
It's certainly nice to have as an option. It's another tool. I always tell people that you can't turn this computer off when you turn that computer on, because it's still critical for the surgeon to do all the soft tissue work, ligamentous balancing, to check the rotation and that type of thing. And there are certain deformities that are outside the realm of what the robot can handle. We had the latest generation of robotics though, so you may have heard in times past where people had to get an MRI or a CAT scan or something ahead of time. That's previous generations. We don't have to do all that additional imaging now because the current robot can read where the bones are in the room.
Okay, I want to talk to you too before I let you run to the patients that are waiting for you as if I were one of your patients, because I have to tell you, it was very impressive to me to listen to you explain all of this. You clearly have heard a lot of the same questions, I'm sure, on a repeat basis, but you explain it very concisely, and I would think that's a real comfort to your patients because they all come in with their own questions, and it's nice to hear the tone you take with them.
Well, Julie, I appreciate you saying that. I've never lost awareness of the fact that patients have a choice, and I consider it an honor and a privilege for them to put their care in my hands. And I also understand that while this is routine to me, it's not routine to them. And so I think it's important to meet everybody at their level and explain things. Another point that I wanted to share with people that may be anxiety producing is the longevity of the prosthesis. It used to be that you were lucky to get 10 years out of a hip or a knee replacement. Now routinely we expect this to be a 30+ year joint. So the previous generation, 94% of knees were doing well approximately 18 years after surgery. Now we're hoping that'll be 30+ years. And one of the exciting things about that is that it makes it an option for younger patients.
So in terms of getting in to make an appointment, you kind of took us on this gamut of what your most conservative approach and your most aggressive approach might be. So once someone makes an appointment with you, you'll assess their individual case and go from there?
Absolutely, because I want to make sure that there's no other options that would help them short of surgery. We'll certainly go through the non-operative options like I discussed with you earlier, anti-inflammatory medications, injections, bracing, physical therapy. Those things may offer patients benefits. But when you get to the point where this is affecting your life and the simple things aren't working, then we'll talk about your surgical options. And then I always tell people that your knee is never going to get so bad that I can't fix it. You can put up with it as long as you want to, but when you get tired of putting up with it, I'll be happy to help.
And if you are a younger person thinking, I don't want to live this way anymore, as he said, this total knee replacement can last 30 years or more. So there's no reason for you to not think about getting the intervention when the pain is great. Dr. Ballard, thank you so much for your time and the education this morning.
Oh, thank you. It's been my privilege to talk to you. I appreciate you, Julie. And by the way, everybody loves you and loves your show, and I hope you're feeling better soon.
Oh, thank you very, very much. I think you just helped me along that path. So you can find Dr. Ballard at Center for Sports Medicine. They have several locations, as you well know, in the Chattanooga area, but there is their main number. If you call and let them know the part of town where you are, they'll help you get an appointment at the location most convenient for you. Thanks again.
Thank you.